Okay, good morning. Today I'd like to talk about how many IVF babies there are. 18 million babies and rising. This video is based on a recent publication in Infertility and Sterility by David Adamson and co-authors, where he looked at how many infants have theoretically been born through assisted reproductive technology. What they did was to go through all the registers of all the major data collection units and try to create some estimate of how many babies have actually been born. So in this paper, they start off by concluding, or they finish up by concluding, that 10 million, between 10 and 13 million babies or more infants have been born from ART in the 40 years since it started, 1978. There's large numbers of infants born from both conventional and innovative applications of ART confirm that IVF has helped millions of people realise parenthood. It is now mainstream medicine, has had a significant societal impact, including novel family formations and highlighted inequities regarding reproductive rights and access to care. So another one of the authors, Georgina Chambers, guesses that between 2018 and 2024, so the data they presented was up to 2018 because a lot of data registers are really quite old because they have problems collecting all the outcome of all the perinatal data on babies born. But Professor Chambers estimates there's probably another 3 to 4, 5 million have been born since the paper's cut out in 2018 set of data. And if you look at the graph from their paper, this was publicly available in Sydney Morning Herald, you can see the exponential rise in theoretically the number of babies born, and the real rise hasn't been in Western Europe, which has been fairly steady, but in China and in Latin America and the Middle East. So here is the graph they presented. This is the variance of the error variance, because not all data register are complete, but you can plot out a curve for that, which is roughly about 11% rise per year. And so you can calculate that. You can go back and put in their data, going through the individual year data, which I've collected and recalculated. In 2018, they theoretically estimate there were about 12,376,801 babies born, which, even though Dr. Chambers thinks there's probably only 2 or 3 or 4 million, would put at 18, the graph actually would suggest it's more likely to be at 27 million. And if you run the graph out to 2030, that gets you closer to 50 million babies born from IVF. I know this is a silly number, 47 million. And I don't know whether that's correct or not. But it just tells you there is an exponential rise. And in the next 5 years, it's unlikely to be different. So some sobering facts, because this was based on the number of babies born, and we make a couple of assumptions that overall is one baby born per delivery, which of course is false because there's been lots of multiple pregnancies in it. So this is a clear overestimate, so you don't need to get concerned about it. It's just playing with figures. If you assume there's roughly three retrievals per child, and there's 2 clients per child, that gives you roughly 8 embryos per retrieval. Looking at those sorts of figures, you could guesstimate in 2025, if there are 27 million babies born, right, that tells you it was based on 82 million egg collections from 41 million women. 41 million is staggering. But what's really worrying is the number of embryos. Theoretically, just running these figures around, just the ballpark on a BMAT sort of calculations, there's roughly 660 million eggs have been processed in IVF. And when you get to 2030, just because the exponential rise of it, there could have been more than 1 trillion embryos have been created through IVF. And if you think about all the babies being born, how many embryos have been created and never used? How many embryos have been created and destroyed or lost? Someone really needs to look at that, because this is different to what happens in nature, where In most cycles, embryos are not created at all, rather than they fail to implant. So just moving on a little bit from that, going back to the original paper, not all things is what they seem. And of course, this is just a bit of fun exploration of the impact of IVF. In North America, as probably in Australia as well, there was an exponential rise, but as you reach some peak where it costs so much, and it's really a mature market, you can see that it is actually sort of flattened out in quite a way. But if you look at Asia, which is well, mainly China, but also Southeast Asia, you can see that the rise is just exponential. But if you look at the numbers, in North America, there's roughly like 100,000 babies born each year. But look at this staggering 700,000 babies born in 2018. Lord knows what it is now. So China has witnessed a surge in demand for IVF in recent years, largely due to social, economic, and demographic factors. The relaxation of the one-child policy, an ageing population, and the increasing number of women delaying childbirth for career or personal reasons have contributed to the growing need for fertility treatments. Additionally, a greater awareness of fertility issues and the availability of advanced medical technology have made IVF far more accessible to couples in China. And of course, in China, if you have 2 or 3 children born through model embryo transfers, all those babies are okay. Just move on a little bit. This is also a graph from the Sydney Morning Herald article, also taken from the answer data set. This looks at 2 things. One is that this is the pregnancy rate against age of fresh and frozen transfers. So this is the pregnancy rate for fresh embryos, about 30%, for under 30s, falling in a fairly steady way to almost nothing over 45. You can still have babies over 45. In fact, we've had 1 or 2, the 48 and 49, over my 50 years of IVF. But what's interesting is that when embryos are selected out for frozen transfers, the rates are obviously a lot higher as well. And the decline is also affected with age, but less so, mainly because the embryo is a bit younger. But this data is also being corrupted by the transfer of lots of eggs that have been donated from younger women. The point, though, is that the graph does show 2 things. There are trends in IVF. One is that it's definitely age-related, and there's a trend there to treat more older women and to allocate more cycles to PGT-A, where all the embryos are frozen and where all the transfers will be frozen transfers, is changing this dynamic mix. And so the graph we had for the number of babies born rising at about 11% per year is being distorted, both because more women coming through are older with a lower chance of success, but also an increased chance of success because of PGT-A and cryopreservation. So Professor Chambers says that statistics that 1 child is born via IVF every 35 seconds somewhere in the world, and 1 in 16 children are born by IVF in Australia, may suggest that IVF will solve Australia's declining fertility rate, but there's also a risk it can have an adverse reverse effect. That is, it may encourage women to delay pregnancy, and then the rates of uptake of IVF will increase. And the social infertility will continue to rise. But this is just a very common article now. This one's been in The Guardian. The equivalent of 1 child in every British classroom is now born by IVF. So this headline basically indicates that IVF is both passed into the mainstream and is now normalised. There's some funny ones, which I think I put this in, but I don't know that contributes much to the argument, except to say that embryos can be kept for a long time. And currently I haven't seen figures on how many embryos are in cryo storage, but it must be in the order of millions and millions. Most babies now are born from frozen embryo transfers, and they could have been born from embryos frozen quite a few years ago. And I would even have it as a guess that there's probably enough frozen embryos already in storage to meet all future demands for IVF. We could probably stop IVF and just give away donated embryos to anyone, and we wouldn't have such a huge demand, we wouldn't even meet the demand for ages. But one of the interesting things about IVF is this being talked about to reduce to address the implications of falling birth rates. So this is an article in Human Reproduction by Bart Fowler and others. So these David Adamson as well, which I'm a lot impressed with. The major advances in fertility care have dramatically improved family building opportunities since the 1990s. Although up to 10% of all children are born as a result of fertility care in some wealthy countries, there is great variation in access to care. The high cost to patients of infertility treatment renders it unaffordable to most. Preliminary studies point to the increasing contribution of fertility care to the global population and the associated economic benefits to society. So already here we're talking about IVF being, because of its cost, is being limited to only a small group of societies, and wealthier countries may have greater impact. And then it gets to the argument about whether IVF should be publicly or privately funded. This is a graph also from this paper. They made a couple of points. Having a family is a human right. Everyone should have the right to having a child. And the strategies for building a family should involve infertility prevention and also family planning. And if you look at the number of children, the number of children born per woman in Western, most developed countries, it's falling to somewhere less than 2. I think the replacement is 2.1. So theoretically, in most developed countries, populations are going backwards. And in the least developed countries, you can see that it's fallen quite a lot, from 6 or 7 or 8 children per family per woman down to 4. But they're arguing that projecting by the time we get to 2100, that even less well-developed countries will have significantly reduced the number of children per woman. And they're suggesting that indeed that the number of countries that are below replacement level is in 1950 was only about 5%. About half the countries in the world are running below replacement level and are being funded through IVF and migration. And they're arguing that by 2100, almost all countries will be having fertility, which is less than replacement. And one of the interesting things is they're talking about lowering fertility rates, but there's a big argument about whether this is infertility or social infertility. And one would suggest that, in fact, it is purely social infertility. So what we're seeing is huge social changes in the way women approach motherhood. And if you look at how countries have responded to that, the third point they make is fertility care should be more accessible. So in places like Israel, Japan, Australia, where IVF is fully or really well funded, you get quite high participation rates per million people. But when you get down to Latin America, India, and Africa, even China, where the support is less pronounced from the government, the penetration rate is a lot less. But then you might like to stop and think about how wonderful we are making all these IVF babies. But one should stop and ask the question, are these babies healthy? In an article in Fertility Australia in 2023, Anya Pingborg and authors looked at the long-term health outcomes for children conceived by IVF. And they made these comments. This is a free article, it's open access so anyone can read it. The short-term outcome of children born after ART is well known from numerous publications, with high rates of preterm birth and low birth weights in children born after fresh embryo transfer, and high rates of large for gestational age and high birth weights in children born after FETs, compared to children born from spontaneous conceptions. High rates of birth defects in children born after ART have also been shown consistently over time. Studies in long-term health outcomes after ART are scarcer, mainly because we haven't got that many babies surviving from the 1980s, etc. But they suggest an increased risk of altered blood pressure and cardiovascular function in children born after IVF. And this is a table they presented. I thought I'd just put the whole table as it is. The primary one is ART increases the risk of preterm birth, low birth weight, and birth defects. These risks are particularly observed in multiple births. However, a certain risk increase remains also in singletons born after ART. Children from FETs are more likely to be large for gestational age and have a higher birth weight. The risk of cerebral palsy is diminished, mainly because of single embryo transfers. The studies on cardiometabolic health in children after IVF are conflicting, but there is some suggestion there is a increased risk of high blood pressure and early markers of late onset compromised cardiometabolic health may be present. That is, children born to IVF who are now reaching middle age appear to have just a slight increase in cardiometabolic problems. The risk of malignancy does not appear to increase in children in IVF, but may increase slightly in children after FETs. And there is some work that people looking at the neurodevelopment health and skill performances are similar in singles born after ART. But there's still some papers suggesting that it needs more work. I'd like just to talk briefly about the number of eggs collected. I know this is a silly graph, but if you go to this publication looking at the reproductive technology surveillance in 2018, this is what, 7 years ago, you can see that from the number of procedures born, roughly 207,000 procedures in 2018, you had something like 73,000 babies born. Roughly about 1 chance in 3. So you take the data set as a whole, young and old women, a mix of donated gametes and own gametes, they're roughly having about 1 baby born for every 3 procedures, which is still, maybe low, but still fairly impressive. So if you go back to my guesstimate of 38 million cycles having performed, that is 380 million eggs have been collected. If you go back and look at in human reproduction, these authors from Italy looked at what was the contribution of what they're saying is MRA, which is the same thing, medically assisted reproduction. This includes AIH and other aspects, not just IVF. In relation to age, that Mark contributed 3%, almost 4% of Italy's total fertility rate in 2022, and after 6% of first births. The contribution reached 16% of women aged over 40 and 31% of women over age 40 at their first birth. If you look at the allocation of funding from between public and private sectors, this is the one in reproduction by Bart Fowler and Mick Macklon. They're looking at the allocation of resources between public and private funding and how that will impact going forward. If more IVF has been required, who's going to fund it? Is it going to be public purse, which increases the participant rate, or private, which will increase because the cost will be selected to only a small echelon of the society. But currently they estimate that most of the research funding is coming in the private sector, and the ability to provide high quality programs are in the private sector. But in the public sector, there's more opportunity for follow-up of children, so children can be followed up rather than just lost to the system. And the more likely part of a multidisciplinary approach, looking at fertility rather than just infertility. So you look at male health, female health, child health, as opposed to just doing the procedure and getting on with it. But more of the intervention work is being done in the private sector. There's more scope to do the evaluations, looking at the health of children, etc., in the public. So in conclusion, it's now time to fully recognise and develop the exciting opportunities that a more active collaboration between public and private can offer. It's time to stop the battle and to work together to grasp the prize in front of us. It's good wishful thinking from Professor Bowser. If you look at the Daily Mail, you see some of the politics. This is an article in the Daily Mail in October 25, where the NHS bosses are being accused of adopting IVF policies which are discriminatory towards straight couples. So this is an article about the use of IVF for family planning in non-infertile couples such as same-sex couples or single women. And they showed the data of the number of NHS-funded IVF cycles over time, where it rose quite a lot about 2018, then fell, seemed to have stabilised around about 20,000. And they showed these two graphs are rising for lesbian couples, and for single women, that's mainly fertility preservation work. But in reality, compared to the 20,000 for infertile couples, there's only about 800 cycles in the public purse for these Well, Daily Mail still made the point it can reveal that the number of women with male partners undergoing cycles of taxpayer funded fertility treatment each year has fallen 28% since peaking in 2016. Despite the drop in straight women accessing NHS funded IVF, the number of single women gifted free fertility treatment has more than doubled in the same time, mainly because it didn't exist 20 years ago. Almost half of them were the age between 18 and 34, which means they still had many years of natural opportunity left. But the numbers really are very slow. But if you go back and look at the difference between public and private, this is the number of births in the public sector, which is roughly around about 20,000 a year. But you can see the number rising very slowly from somewhere about 28,000 to more like 40,000 in the private sector. But if you go back and look at the number of cycles broken down by public and private, you can see that the public sector is struggling to provide much, but in reality contributes very little. And the bulk of it still is for infertile couples. But in the private sector, it's rising. It's for when they say straight couples, one implies these are infertile couples. But the lesbian couples and same-sex females with fertility preservation is actually rising enormously inside the private sector. So to meet demand, many services are being transferred from the public system to the private, and the public system needs to provide services across the social spectrum. Many mainstream services are performed in the private sector. So really IVF, even in some place like England with the HFEA and the national NHS system, most of the work is being done in the private sector. But there's one consequence of this, and this is work pressure and burnout. So here's a couple of articles. This is one suggesting 43,000 more embryologists were required and 4,000 more new IVF labs were required by 2035. That's only 10 years away. And demand for IVF is increasing, not just for infertility. Changing nature of family decisions and changing demand for IVF technology are all fueling this. But as a client, if you're coming through an IVF clinic, it would be prudent for you to ask your clinic about staff health, workloads, and staff turnover. Here's a couple of headlines. This is the article, Inside Reproductive Health, which is quite a good read. Overwhelmed on a daily basis, fertility doctors respond to genetic risk, burnout in embryologists. And there's a couple of papers which are suggesting, in England at least, and there's no difference anywhere else, is that work in the laboratory now is so complicated and so critical that there is just basically people getting burnt out. But one of the real problems is all the genetics is being done and how people are requiring the genetics to deliver. And there will be cases where the genetics does not deliver what they claim, and the legal risk will be higher. And you're seeing down the bottom, this is the first case we're talking about how AI and robots are responding to this huge demand for labour. And just a couple of papers just to the end, just to give you an idea where it might be going. You can look at the influence of AI in IVF, and people are trying very hard to make a case for it, particularly with the non-invasive selection of embryos to work out which are the best ones to put back. And there's just more papers on IVF. They're all trying very hard to prove that AI can make a lot of difference. The real sad thing is that AI does make a difference in terms of giving embryologists confidence that the embryo that they were choosing was probably the best. And increasingly, they're trying to predict the ones that are euploid, and there will be a movement to use AI to predict embryos for their ploidy, which will give you a lower miscarriage rate and a shorter time to pregnancy. But nothing will, at the moment, will actually beat an experienced embryologist's eye. But the real thing that's worrying, if you look at the Brave New World, Foretelling the Future, journal Clinical Medicine this year in May, pre-implantation genetic testing and the coming of polygenic embryo screening. This is definitely the canary in the coal mine, and clinics really need to be aware that in 5 years' time, they may well be flooded with requests of fertile people seeking to have babies that don't have risks of breast cancer or dementia or bowel cancer, right? And there's not going to be enough genetic counsellors or experience in clinicians to be able to handle this. And clinics need to be aware whether they should be accepting this or not. So the pre-implantation genetic testing has been used in various forms over the last 2 decades. PGT involves testing early embryos following IVF. It's now become an accepted part of genetic testing. This is mainly for euploid, the number of chromosomes, to make sure there's no Down syndrome, etc. Nowadays, PGT serves as a resource for couples who have a family history of monogenic diseases, wherein the fetus is at high risk of inheriting the condition. And of course, the heart goes out for all of those. The latest PGT direction is polygenic screening of embryos, what they call PES or PGT-A, which allows for the identification of embryos that are at elevated risk of significant diseases in adulthood, such as coronary artery disease, diabetes, hypertension, and breast cancer. And at that point in time, I think I need to stop. I'd like to finish with comment in an article talking about the centenary of the birth of IVF pioneer Sir Robert Edwards. The potential impact of IVF will go further than Sir Robert Edwards or any of the early pioneers can ever have imagined. It will extend to the creation of many millions of people and may even address the world's population crisis in providing a route to pregnancy which otherwise was beyond reach. Reasons indeed to celebrate the centenary of Sir Robert's birth, and indeed I do. So last word from the first article. Today, an ART conceived infant is born every 35 seconds and makes up to 0.5% of all global births and 5 to 10% of births in some high-income countries. Because the prevalence of infertility is similar across countries and regions, remember that's not necessarily physical infertility, it could be social infertility. These data and other means that the need for ART cycles globally is tenfold higher than what it currently is, and which will result in 10 times more infants per year, potentially contributing to a significant number of infants in the world with decreasing total fertility rates. It's kind of scary. And I've demonstrated just how many embryos are being processed and how much material is being used. There are many demographic, sociological, ethical, and economic reasons that greater access to fertility care will occur in the future. It is to be hoped that this growth will increasingly be grounded on rights-based, equitable access to ART and fertility care, and I think that is just a pipe dream. Last word from IVF Daily. These are my views. Even though ART conceived infants are born every 35 seconds and make up to 5% of births in high-income countries, this assumes that all IVF is directed at infertility. As the age of women attending IVF increases, so will the number of cycles with fewer children. But also they'll be born to women that are older. So in the past, humans have been born to women in their early to mid-20s. But we're now going to have a generation of adults being born to very older women, and I have no idea what that means, but I suspect that you're more likely to have increased morbidity associated with older women having babies. That's 100 years down the track. There are significant trends now and in the near future to augment fertility with fertility preservation and polygenic screening of embryos for detectable diseases. This will fundamentally alter the reason for IVF, and it is indeed a scary, scary future. I'd just like to finish by welcoming and saying, well, thank you. And a disclaimer, my name is James Stanger. I'm an embryologist with 50 years experience, and this YouTube channel is an attempt to make the gap between information you receive for your treatment and the most recent publications available to your staff. I'm not a medical person, and this information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor, and maybe help in understanding the advice you receive. If you like what you've heard, even though I'm mumbling and carrying on, please subscribe. You can make a donation to my GoFund page. But whatever you do, please leave a comment and tick like if you think it's worthwhile. And I'd have to make a point that my sponsor is my own company, FirtAid. FirtAid is an online EQA and training program in IVF in andrology. It provides a journal-based education portal at IVF Daily, and clients can benefit from knowing the skills of their laboratory staff are under constant review and assessment if they're using my program. And at the point, I think I will say thank you and recognise that IVF is a personal journey that involves many actions and many things, many people. It helps to understand all aspects of that journey, and I hope this information may be of value. If you like the information provided, please tell other IVF clients about this service and please subscribe. Thank you.